There is a alarming news for the asylum seekers or refugee claimants in Canada. Canadian government as of September 30, 2025 will stop funding hotel accommodation for asylum seekers. Hotels have been used since 2017 as a temporary shelter system where municipal shelters and other existing infrastructure were overwhelmed by the number of incoming claimants. At its peak, dozens of hotels across several provinces were used. As of mid 2025, only about 485 asylum seekers remain in a government funded hotel rooms in Ontario, Quebec, and spread across 5 active hotels. Since 2017, over 1.1 billion Canadian dollar has been spent by the federal government on hotel accommodations for asylum seekers. In addition, through the Interim Housing Assistance Program or IHAP, the government has transferred approximately 1.5 billion Canadian dollar to provinces and municipalities to help them cope with the costs of housing and supporting asylum seekers and overflow of shelter demand. Budget 2024 committed another Canadian 1.1 billion dollar over the 3 years to expand this housing program, which is Housing Assistance Program or IHAP, but with a shift in focus toward more sustainable housing forms rather than temporary hotel rooms. IRCC, the Canadian Immigration Authority, stated vision now is to transition people from hotel stays into community-based housing and to help asylum seekers find more stable or permanent housing solutions. Measures include issuing notices to vacate to encourage people to leave hotel settings, offering relocation to provinces or municipalities with more affordable housing and supporting services like job training, language classes, etc. Temporary reception centers, wrap around support services, and enhanced case management are part of the plan to help claimants become self-sufficient. But still there are critics of this decision of the government. Patty Lerand, University of Ottawa, the professor argues that simply ending hotel funding without ensuring stable housing will lead to many asylum seekers, including families, being left with nowhere safe to go. She emphasizes that those without any alternative housing should be permitted to remain in hotels under federal funding until better options are secured. Another university professor, Christiana Kazak, who is the professor of University of Ottawa, she says community-based housing with wrap-around supports in both more cost-effective and yields better long-term settlement outcomes than hotels. She warns that ending hotel funding too soon could violate Canada's domestic and international legal obligations and lead to increased homelessness. Another expert, Adoma Peterson, have raised concerns about landlords refusing to rent to asylum seekers, lack of affordable housing, and how health can be compromised for those in unstable or substandard living conditions. Many asylum claimants, especially recent arrivals or vulnerable families, may struggle to find affordable housing in big cities. Without enough options, they may end up on streets, in shelters, or other precarious living situations. Also, insecure housing is linked to physical and mental health risks, stress, poor sleep, exposure to cold or unsafe living conditions, difficulty accessing health care. Hotels are less conducive to integration, limited access to community services, education, job opportunities. Moving to community housing might improve access, but only if systems and supports are in place. So that is one thing in community living, people can get access to many opportunities. But in Toronto and other big cities, there are limited access or limited accommodation in the shelter homes or other settings. So government and many organizations should also think about this. While ending hotel funding is meant to reduce federal spending, there will still be cost in transitioning people. Funding for social housing, case management, relocation, increased services, poorly managed transition could lead to higher cost downstream. So now government what can do to make this shift work without undue harm? Some measures could be taken. For example, rapid scaling of affordable or transitional housing. Enough units need to be built, subsidized or repurposed to absorb those living hotels. Wraparound supports, not just housing but support services like health, mental health, employment, language are vital for settlement, and coordination between federal, provincial and municipal and non-profit organizations. They have clear planning and funding among levels of government and community organizations, and protection of our vulnerable claimants, especially families, people with health issues, etc. Ensure no one is forced into homelessness. And also monitoring is important. Keep track of outcomes, how many displaced, how many find housing, rates of homelessness, health outcomes, etc. So as Canada has legal obligations under domestic law and international human rights treaties like the Refugee Convention, government has to ensure asylum seekers have access to shelter and basic needs. Experts already warn that cutting off hotel funding without sufficient alternative housing could run afoul of those obligations. Ethical concerns arise over the treatment of vulnerable populations, families, women, children, if they are forced to unstable or unsafe environments.